So a lot of time, clinicians try to assess the body posture. This is very common to see that the people try to assess the body posture. While it's actually a good thing to do, it might not be the only symptom that we can find from the bad posture.
那这里呢有非常多不同的这个动作的这个应该说站立的这个模式哦，但不同的模式当然都有可能产生下背痛的问题，只是产生原因成因不同。那我们现在就来分析不同的这样的一个站姿呢，都可能产生哪些的这个下背痛的这个情况。
So those of you who have been to my body assessment class, okay, I always ask those students, what would be the higher risk of these postures get some kind of low back pain? And then the answer that I always give to my students, all of them actually have a chance to get the low back pain because it's not only come from just the posture, it's coming from different sources.
那事实上，这5种站姿呢，都有可能产生下背痛的问题，那只是成因不同，那几率不同而已。那因为下背痛的成因来自很多不同的可能跟情境，所以这个部分先跟大家说明。
Even for the person who have a very almost perfect posture, if you have a muscle imbalance, if you have the habit to use the one side compared to the other, that can also raise the risk of low back pain.
比如说，在最右边这个，从这个角度看起来，好像他的这个站姿是几乎完美的状态。当然，如果呢，他有常常习惯使用单边的力量，或者他的左右两边肌肉不平衡，从这个角度是看不出来的，他还是有可能产生下背痛的问题。
So while postural assessment is very important, I also do too, but you have to check other parts of the body to see if there's any limitation from those places.
好，所以呢，上头的意思是说，从这个站姿来分析它可能产生的下背痛原因，这个是一个很好的一个角度，一个切入角度。但除了这个角度之外呢，还要从以下接下来的内容里面来看到更多可能的成因。
So in my body assessment course, I do a series of joint by joint, segment by segment analysis to make sure that that person can have a sufficient range of motion from each part.
所以呢，在大致上的教的这个所谓叫 body assessment 身体检测的过程里面呢，它试图从不同的关节的组织，从不同身体的部位批次性来分析，一层一层来分析你的这个关节活动度啊、你的稳定度等等这些的状态，来看你是否可能产生下背痛的问题。
So let's take a look at some examples here. So again, those of you who came to my course before have seen this kind of stuff. So this is the scapular retraction testing, and then this one is a spinal rotation assessment.
像这两个图啊，这两个影片，这个在做肩关节后缩的能力的分析，这个在看你的身体的脊柱的活动度的分析。
Some people ask, why do I check the scapula for low back pain symptom? Okay? If your scapula is always protracted or cannot move freely, okay, chances are it locks your spine so much, okay, you cannot move. So I want to make sure that the scapula actually very movable, but also stabilized in a certain position.
那很多人可能问说，下背痛跟肩关节差那么远，到底有什么关系？事实上，如果你的肩关节一直属于这样的一个状态啊，那事实上是把你的身体把它给抑制住了，甚至会影响你的整个脊椎的这个状态。所以呢，事实上，如果你长期处于这种动作的话呢，事实上你是会产生下背痛的可能的。
Okay, and then with the spinal rotation, if you have a very limited range of motion of the spine, when you try to rotate the body, something has to do more work because the spine doesn't rotate. And then typically it's coming from your pelvic, and then also lower body try to do too much, and then that causes a lot of stress in the lower back.
那像这个啊，在看你的整个脊柱的这个活动度，如果你脊柱活动度很差的时候呢，就产生代偿的可能。比如说你的这个髋关节啊，或者是你的下背啊，可能都产生一些代偿，那就可能造成下背痛的成因。
And then I do several other testing, of course, down the shoulder, okay, sometimes on the neck and the lower body. But combining all that information, if I find some limitation, that can trigger to put more stress on the lower back.
所以除了检查这些地方，包括检查你的颈椎啊、你的胸椎、你的腰椎、肩椎等等不同的关节的活动度跟稳定度，都可以看到一些可能产生下背部疼痛的一些问题。
So doing assessment is very important. I always say that without assessment, you're basically guessing what works for that individual. So assessment part is very important.
所以呢，对一个你的客人，尤其是刚接触的客人，或者训练一段时间的客人，重新再做检测呢，都是让你帮助你更了解你的客人。那如果你没有做这些检测，其实你就是用猜的，代表你对你的客人的状态是没有那么理解的。
So let's go to the next step. Once you do the assessment, all the patients, whether it's athletes or general population, the next question I always get is, okay, what can I do to fix? Okay, so that's the most important part of us coaches and trainers have to know.
所以呢，当你做了检测，当你做了正确的检测之后，看到了一些状态之后，下一个问题一定是，那到底我要怎么帮忙他矫正，帮他把这些问题给解决？所以我们接下来讨论这个部分。
And I believe this is the missing link when I do body assessment course in different countries, including Taiwan. Okay, the assessment part is actually fairly easy to know how to detect limited range of motion. However, what to do to fix that problem is the most important part.
那大致上过去在包括日本啊，还有欧洲几个国家，像斯洛伐克、捷克、波兰都做过body assessment的这个课程教学。那事实上从这些所谓关节活动度的检测呢，看到你的客人的身体的这个限制的这个准确度是非常高的。但下一个比较大的挑战是，到底要选择做哪些的动作模式，跟怎么做来解决你客人的问题，是一个比较大的挑战。
Okay, so let's take some example here. When you actually prescribe exercise routine, okay, you have two different ways to do the progression. Okay, one is called movement quality progression, and then the other one is called intensity progression.
所以今天如果你要帮你的客户开始产生一些矫正的行为、一些训练的这个规划的时候呢，有两个方法，一个就是透过动作模式的这个进步或者品质的提升来产生这个进阶的状态，或者是透过它的强度或者是它的阻力的增加来达到这个进阶的状态。
Traditionally, especially from the textbook information in the clinical field, I see a lot of intensity progression. Basically what it is you put more weight, you put more resistance to the body to strengthen the muscle.
在大部分的教科书里面，通常教你的是你放更多的重量，放更多的阻力呢，来强化或者是来刺激你的肌肉骨骼神经系统，来达到进阶的目的。
But the ones I explain in my body assessment course is actually the movement quality progression.
但是呢，事实上他也非常强调，他的课程里面非常强调，从你这些动作的进阶品质的提升，来达到所谓的这个进阶的这个目的。
This is for me very important part because if you have a poor movement quality, when you actually go up on the intensity, that gets more stressful for the body. So the movement quality has to be higher before you move up on the intensity.
也就是说呢，当你假设我们做5个阶段的进阶动作的安排，当你在第1阶的动作就已经没办法产生非常好的一个动作的控制或者动作的这个品质的时候，你要试图再往2、3阶做的时候，到2、3阶你的动作模式会更糟糕，甚至可能产生身体代偿的状况。所以透过对动作模式跟品质的这个理解，来达到进阶目的是非常重要的。
So what I do in my body assessment course, I introduce level 1, level 2, level 3, some movement quality progression of doing a lot of scapular mobility work to make sure that the shoulder can go to retraction position. Okay.
所以呢，在他的课程里面呢，教到非常多关于肩关节，不管是后缩或者肩关节旋转的那种能力的这些动作模式。
And then I'll do a little bit of rotation with the resistance, okay? So the person can create more trunk rotation, okay, while stabilizing the scapula.
像这个就是用拉力绳的方法产生阻力，然后要求这个教练呢做这个所谓的动作脊柱的旋转， 那在旋转中，它还要维持核心稳定跟肩关节的稳定性。
And then the level 3, now I create this scapular mobility to be more on upward, downward rotation. Okay, a lot of people don't actually have this mobility when it comes to the scapula. So I try to make sure that the scapula move upward, downward rotation.
那这个动作的这是第三阶，第一阶、第二阶、第三都是跟肩关节有关的。这个动作在做肩关节的上下的移动，同时要保持它的非常好的稳定性。
Okay. If you don't have a very good progression, okay, you might overreach some clients' potential, okay, or you might do underreach. And again, the progression can give you the optimal zone of exercise selection.
所以，如果你没有这种动作进阶的这个分配的观念，你有可能做的对你的客户做的太高级动作做不到，产生受伤的可能或代偿的可能，但也有可能做的太轻了、太简单了，那客户觉得这个根本对他们没有产生任何的刺激跟进步。
Okay.